Let's do something on education and COVID. Three teacher unions are resisting plans by the Ghana Education Service to open school in June. The Ghana National Association of Teachers, NAT, the National Association of Graduate Teachers, NAGRAT, and the Coalition of Concerned Teachers wrote to the Director General of the Ghana Education Service, Professor Opoku Amankwa, warning that there will be poor patronage of classes should government go ahead to reopen schools without conferring with parents and teachers on the way forward. Let's go to the phone lines now. We're joined by the president of NAGRAT, Angel Kabonu. Mr. Kabonu, on what basis is the teacher unions, are these unions saying that, there'll be poor patronage? Is that what parents are telling you, that they are not willing to let their wards go back to school?
We did not say that there will be poor patronage. We are calling on government to resist attempts by certain faceless people to compel it to open the schools, and that the current situation is such that it will be in the interest of parents, students, and teachers if the schools remain closed. That was the import of our statement.
So, I just want to quote portions of the statement you issued, and that letter you sent to the Director General of the Ghana Education Service. The very last point says that majority of teachers and students will have to commute from their place of abode to schools, hence increasing the risk of infection of COVID-19. Then it says that pre-tertiary education unions would not ascribe to the reopening of schools should the President of the Republic decide not to extend the 31st May 2020 deadline and order the reopening of schools. We cannot expose our teachers and students to the COVID-19 pandemic with its attendant sorrows and gnashing of teeth. But before that, you also said that the items for observation of the prescribed schools, that is cleaning your hands, washing your hands at the running water and all of that, the sanitizers are not available. The Ghana Education Service was asking for your input. Are these recommendations you are making to them, or you are saying that you are simply not ready to get schools reopened?
Our most useful and practical input is calling on the Ghana Education Service and the government at large not to reopen the schools based on the statistics that are available with regards to COVID-19.
You talk about some faceless people trying to get government to compel government, those are the words you use, to reopen schools. What is your suspicion?
Well, I think that these people may have their parochial interests.
Who are these people?
Well, that is why they are faceless. So I will not be able to...
Mr. Kabonu, you must know that some people are pushing this move to make such a comment in the first place.
Oh, absolutely. From where I sit,
yes,
I know, and I even know those people and the reason for which they are making this. But I don't think that it is appropriate to mention their names as of now.
Why do you think they are pushing for schools to reopen then?
Well, maybe because of their personal and parochial interest in the whole issue.
Which
and
is?
For us as union, we are looking at the issue of life of the students and life of teachers.
Mr. Kabonu, are you referring to the private schools, the leaders of the private schools?
I have not mentioned any name.
Because in this conversation, they are the most affected, and especially for the thousands of teachers they employ who are not receiving salaries, some of whom have been laid off. And so for them, they are earnestly looking forward to schools reopening so they can put in place measures to ensure that the school environment is safe for the pupils.
No, I have not mentioned their name.
So, Mr. Kabonu, when do you expect that government would take such a move? Well,
for us, statistics and the science, the scientific situation should guide the nation. When the schools were being closed, we had a certain number of infected people. But today, as we speak, the numbers has gone beyond 5,918 or so. And the death is also gone beyond, I think, 32 or so. the level of infection is horizontal infection and no longer vertical infection. What that means is that we are infecting ourselves in the country as at now. Can you imagine bringing students to Presbyterian Boys Secondary School or Prempeh College or Tamale Secondary School? For one student who is infected to be among the total number of students, what type of pandemic we will now be grappling with?
So the WHO has told us that this will be with us for a long time. The health minister says we must learn to live with this. Shouldn't we be looking at measures to put in place to get schools back already? Well,
if that is what WHO is saying and it is based on fact, then we also have to change our modus operandi. For example, if it's going to be with us for a long time, like malaria has been with us for a long time, like typhoid has been with us for a long time, like hepatitis B has been with us for a long time, are you going to continue quarantining people for a long time? Because if that statement is true, the next year by this time we should be expecting over 500,000 people under quarantine. Which country can be able to quarantine people 500,000? You sure we can do that?
Should the president decide to lift the ban to ask schools to reopen, are you teachers ready?
How can you be ready when your life is at stake? You mean we should be ready and go and die?
If government decides to give you protective gears.
But your station this morning interviewed a medical doctor from Tamale Teaching Hospital who was in protective gear, got infected by a coronavirus patient, and was flown from Tamale to Kolebu ICU unit.
Yes, Mr. Kabonu, but...
And she is a trained medical practitioner. I am not a trained medical practitioner. Even she, though she is a trained medical practitioner, got infected and was flown from Tamale to Kolebu ICU for treatment. She indicated this morning on Joy FM that even while she was in intensive care, the situation was so bad that she started writing her last statements to her family. You mean teachers will be prepared and ready to handle a situation like that, though they are not medically trained?
You're going to have the sanitizers, for instance. You're going to have water. You're going to... what if the GES, for instance, decides that together with the health ministry, they're going to run testing in the various schools to be sure that those who are positive are isolated, and then there'll be some social distancing protocols observed in the classroom? Wouldn't that work?
What then will be the educational effect of those who have been isolated? You say people should come to school and learn, and then you realize that you have started isolating them because they get infected. What then will be the use of asking them to return to school when eventually those who get infected will be isolated?
Well, you don't expect a huge number of people to be infected, and you
never know. One factory in Tema, fish processing factory, got over 500 people infected by one person.
So, Mr. Kabonu, assuming that this does not go as soon as possible, and indeed we are being told to learn to live with it, when do you expect that schools would resume?
That's what I'm saying, that they should quickly define properly what they mean by we should live with it. If we are going to live with it like the way we are living with malaria, typhoid, and hepatitis B, that like the United States of America, like in... you just walk into a health facility and ask for treatment. If we are living with it in that manner, and they know that they have once we are living with it, then we should also have treatment needs. Then it becomes a normal disease added to the numerous diseases that we have in this country. Then, but if that situation does not change based on science, how do you say that the numbers are going to go up? We are going to live with it. For example, the question you asked, that when people are found to be infected, they will be isolated. And I asked you, when you isolate 200 students, why have you asked them to come to school?
200 out of thousands of students.
So that is significantly huge. result is significantly huge because one person in Tema infected 500 people.
Would you want to continue with the e-learning program? What will be your assessment of that?
Well, my assessment of the e-learning program is that in as much as it has come to fill the gap somehow, have not been very effective because we do not have an IT fundamentals in this country. The fundamentals for technology in teaching in this country is very, very weak because we have never anticipated the situation we find ourselves and maybe the way we do things. For example, you and I know that before COVID-19, you cannot even take a laptop to school, an iPod to school, or a phone to school. So, I mean, and then again, how many people, even in Accra, how many children do have some of these gadgets at home to be able to access e-learning?
And so, Mr. Kabonu, are you meeting with the Ghana Education Service? Are you thinking around this? Are you willing to be a part of proffering solutions to help education in Ghana?
Well, why not? You and I have just spoken for about some 5 to 6 minutes now, and I am preferring my views to you. The same way, tomorrow there's a meeting between us and the Ghana Education Service. Let everybody know that we are talking first and foremost the preservation of life. That is the fundamental basis of what we are saying, the preservation of life for teachers and for students. How can you talk about education delivery when there is no life?
Mr. Kabonu, thank you very much for your time here on Newsdesk.